The symptoms of angular cheilitis are pain and inflammation in the corners of the mouth. This condition affects one or both of the commissures on the lips. It also affects the skin of the face. There is no specific cause for angular cheilitis. However, certain people are more susceptible to the disease, including people with eczema, the elderly, and people with immunosuppression. Treatment for angular cheilitis is often straightforward and involves addressing the underlying cause. In many cases, a fungal or bacterial infection is responsible for the outbreak. In rare cases, angular cheilitis can develop into oral thrush. The treatment for angular cheilitis is determined by the underlying cause. If a yeast or bacterial infection is to blame, you may have to take a topical antifungal, which is applied directly to the skin. An underlying nutrient deficiency may also be to blame for the condition. Individuals who do not get enough iron and B12 often experience angular cheilitis. To treat angular cheilitis, try taking a vitamin B or home iron supplement. These supplements may help keep your lips healthy. Alternatively, a diet rich in zinc may help. If angular cheilitis is caused by a bacterial infection, you may be able to relieve your symptoms by applying a topical antibiotic. Antibiotics will help to seal out the excess moisture in your mouth and kill aerobic bacteria. If you are suffering from bacterial cheilitis, you might need to take an antifungal medication. This condition can be caused by diabetes or by an allergy to certain foods. If you have a fungus infection, you will need to consult a doctor. The cause of angular cheilitis varies from person to person. If it is caused by a bacterial infection, your doctor will likely prescribe an antibiotic to kill the fungus. If you have a fungal infection, a prescription topical solution that contains the antibiotics may be appropriate for you. A combination of both medicines can be used to treat angular cheilitis. Angular cheilitis is a relatively simple condition to treat. It can be a simple fungal infection or a bacterial infection. The underlying cause will determine the treatment of your angular cheilitis. If you suspect a yeast infection, your doctor may prescribe topical antifungal creams to clear the infection and protect the area from future infections. The symptoms of angular cheilitis can vary. Some people are more prone to it than others. Smokers, people with braces, and people with sensitive skin are all at risk. For those with bacterial cheilitis, an antibiotic may be necessary. Other causes of angular cheilitis include anemia, thyroid disorder, and vitamin deficiency. If your angular cheilitis is caused by a bacterial infection, it is important to see your doctor to find out what the underlying cause is. In some cases, angular cheilitis is caused due to a yeast infection or a vitamin deficiency. In some cases, the angular cheilitis can be difficult to treat. A doctor may prescribe a topical treatment that will relieve the pain. If you suspect angular cheilitis, it is best to see a doctor as soon as possible. If the condition is a symptom of another disease, you should seek treatment from a dermatologist right away. It may be a pre- or post-existing condition. You should see your doctor as soon as possible if you suspect angular cheilitis. Angular cheilitis can be caused by a bacterial or fungal infection. Your primary care doctor can help you determine the cause of the condition. The best way to diagnose angular cheilitis is to visit a dermatologist. While a dermatologist isn't required for a simple diagnosis, they are well equipped to prescribe medications and perform specialized procedures. If you suffer from AC and want to look normal again, click the link in the description below to discover a natural treatment for angular cheilitis. Thanks for watching.